Let's talk specifically about the elimination period for Genworth policyholders. When looking at a policy for Genworth, there's a couple things you're going to want to look at. Most Genworth policies have either a 0-day elimination period, a 50-day elimination period, or a 100-day elimination period. And again, you're going to want to make sure that if you're going to do home care, you're going to qualify the policy that it has a home care benefit on it, and then find out what the elimination period is. If it has a 100-day elimination period or whatever the elimination period is other than 0, the next questions you're going to want to ask is, does this policy have a clinical care coordinator benefit? And if it does, we're going to want to ask to utilize that benefit when starting the claim. Basically, what this clinical care coordinator benefit does, Genworth is going to send out a nurse, probably from Care Scout or from another agency, and they're going to come out and they're going to make sure that the policyholder meets the criteria for the care. They're going to put together a plan of care and approve that. And if they use a clinical care coordinator benefit, then the elimination period is waived and it goes down to 0. Don't start the care without asking to have the clinical care coordinator benefit, because then the policyholder will most likely have to pay for care for that 100 days. So that's the Genworth policies and the elimination period. Make sure to ask if there's a clinical care coordinator benefit. If there is, state that you want to utilize this so that the policyholder's elimination period will go from either 100 days or wherever it is down to 0. This is very important for home care. And if they're going to go into a facility, then you may be able to start them at home care for immediately, and it'll get paid for. Every day that they receive home care will count towards the elimination period. So if they have a 100-day elimination period and they receive home care for 100 days, then on the 101st day, then they can move into a facility, and the facility then is going to get paid directly, and the policyholder will not have to meet any out-of-pocket expenses at all from the start of care and even when they went into the facility. So again, Genworth has a possibly clinical care coordinator benefit. Ask if they have it, and then make sure that you have them come out so that the elimination period can be waived.